So I remember when I was an intern in residency. So it was back many, many years ago. And my sister was in town visiting me and had a car accident. And she was in her late first, early second trimester of that pregnancy. And later in that pregnancy, she had her anatomy scan performed and called me and said that they found concerning cysts in the fetal brain. And I was not yet an OBGYN. I was starting out my residency training. And back then, this was something called a choroid plexus cyst. And I really didn't know what it was. And I was kind of starting in training. But even then, years and years and years ago, there wasn't as much data surrounding choroid plexus cysts. And the data we have now is so wonderful to help calm our nerves about the finding of this soft marker called a choroid plexus cyst. So today, that's what we're going to talk about, the soft marker called a choroid plexus cyst. Welcome to the Dr. Lexi show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today we're going to talk about the soft marker called a choroid plexus cyst. So as I was mentioning, when my sister was pregnant with her second child, she had a finding of a choroid plexus cyst. And I remember as an intern talking to the OBGYNs and the maternal fetal medicine specialists that I worked with. And back then, we didn't actually have the blood tests that we have now to test for things like trisomy 13, 18, and 21. And this soft marker is more associated with something called trisomy 18, not trisomy 21. So when we hear soft markers, we often think about Down syndrome. This is one that is associated with trisomy 18, which is called Edwards syndrome. But here is the thing. Now, in this day and age, if you have had a blood test performed to check for your risk of this thing called trisomy 18, also known as Edwards syndrome, if you've had that blood test performed and there was a finding of a choroid plexus cyst that is isolated, we are not concerned. We are not concerned. So this is way different than it was years and years ago because we did not have this blood test that is so good at predicting risk or concern for trisomy 18. So today we are going to focus on choroid plexus cysts and how best to tackle that topic if you are in the boat of having that ultrasound finding on your anatomy ultrasound. Before we get started, I want to make sure that you're aware I have a whole separate video on what are soft markers so that you can really learn more about them in general. We'll touch on it very briefly here. There also is a whole separate video on what is Down syndrome screening. Now, today's soft marker does not carry an association with Down syndrome. I'm going to repeat that. Today's soft marker, a choroid plexus cyst, does not carry an association with Down syndrome. However, the video on what is Down syndrome screening talks about a blood test that does screen for trisomy 18. All right, so I just want to make sure that you're aware about that. Other items to check out, I have a wonderful advocacy assistant that you can download from the website that helps you just communicate with your provider about a pregnancy, and also a download specific to this soft marker. It will be at drlexihill.com/CPC. I'll include everything in the caption below as well. The other thing I want to remind you about is if you are interested in having a step-by-step walkthrough of the different items to advocate for yourself during a pregnancy, I have an entire pregnancy health and nutrition course that will go through some of those questions to ask your provider, videos along the way, and handouts, etc., just to really try to make a future pregnancy for you as kind of calm and relaxing as possible, if that's even a thing. All right, so as we're diving into expanding our knowledge here, let's talk about what a soft marker is. Now, three main things I like people to know about a soft marker. First thing here, it is an ultrasound finding. So at that anatomy ultrasound, specifically that ultrasound in the early second trimester, around 20 weeks, an ultrasound finding that is noted. That's thing number one to be aware of. Thing number two, it is an isolated ultrasound finding. So if it is noted, if a soft marker is noted, it is one finding. All right, it is an isolated finding. There is no associated growth restriction, other structural abnormalities or markers noted. Everything else looks great, but there is one isolated soft marker, which is an ultrasound finding. Okay, the third thing to know, well, what about this one ultrasound marker that is considered a soft marker? It increases the association with a chromosomal abnormality. Now, Today's soft marker, a choroid plexus cyst, has an association with trisomy 18, also known as Edwards syndrome. So now let's learn about what is a choroid plexus cyst. So a fetal brain, brains in general, they have two sides to them, a right and a left-hand side, and they have this beautiful line down the middle. So off to either side, there is a region called a choroid on both sides. And that area is kind of filled in with this whitish look to it. However, if within that whitish matter, we see a black circle, black means that something is see-through or echolucent. If we see a little black circular echolucent area, that is what we call a choroid plexus cyst, because it's a cyst within the choroid plexus. Second thing, how common are choroid plexus cysts? Well, we see them in up to about 2% of pregnancies. I would say on average per month, I probably see 5 to 10 of these, probably because my population is quote unquote high risk pregnancies, and I might get referrals to talk to people about these from time to time. Third thing to know about this, I want to point out, as a choroid plexus cyst, for what we are talking about today, we're talking about it being isolated. So a soft marker is isolated. If, however, a choroid plexus cyst is noted and there are other findings, that changes our counseling and concern for trisomy 18 and increases it substantially. Things like growth restriction, clenched hands, or the fingers don't look formed appropriately. The feet may be in an abnormal shape and turned in a certain fashion. So if anything's going with that, particularly having a very growth restricted baby and even growth restriction with high amount of fluid, all of those things correlate when they're all noted together for a higher concern of trisomy 18. If it is just a choroid plexus cyst by itself, isolated as a true soft marker, we're going to go through what the risks are, and they're not nearly as high as if you see multiple abnormalities or findings. So now that we know what a choroid plexus cyst is, what does it look like? So if you're watching the video, you can see on the left side of the screen, we have the left choroid. So we're on the left side of the fetal brain, and you see kind of like this oblong whitish area. That is the choroid plexus on the left side of this fetal brain. Then when we go to the right side of the image, this is now looking at the other side of the fetal brain. So to the right side of the midline, and the choroid is the whitish area. And then right to the right of it, you can see this measured circle. These don't need to be measured. Sorry about the image of it being measured if you're a sonographer watching this. But just seeing that black circle, we put what we call calipers there, and they're in yellow, so you can see what we're looking at. Again, this does not need to be measured. The size of it does not change the counseling. But that black circle that you can see, that right there is what a choroid plexus cyst looks like. Now that we know what a choroid plexus cyst is, and we know what it looks like, well, what do we need to know about it? First things first, it does not impact the structure or the function of the fetal brain. Super important. Number two, it can be in one choroid or both choroids. It wouldn't change the counseling. Number three, it does not impact the structure or the function of the fetal brain. I cannot stress that enough, all right? Number four, the size of it does not matter, all right? Big, small, medium-sized, no need to measure them. A choroid plexus cyst is a choroid plexus cyst. Number five, it does not affect the structure or the function of the fetal brain. I just want to make sure to get that across. Again, I told you my sister had this way back in the day. It was scary. We didn't have as much information. We have that information now. An isolated choroid plexus cyst does not impact the structure or the function of the fetal brain. And finally, number six, most of these resolve by 28 weeks. Do we have to look at it again to see that it resolved? No. Does it feel like what I like to call a warm fuzzy, like it's really nice to see that it's gone in the third trimester? Absolutely. And I mention this again. This that we are talking about today for a soft marker is when a choroid plexus cyst is isolated, the only thing noted on the ultrasound. All right, so let's get into kind of like the weeds here a little bit, kind of sort of. We are going to talk about answering this question. How does an isolated choroid plexus cyst change the risk of Down syndrome in the pregnancy? And you're going to love my answer to this. It doesn't. A choroid plexus cyst, again, is a soft marker associated with a different chromosomal abnormality, trisomy 18. So now the question, how does an isolated choroid plexus cyst change the risk of trisomy 18? Well, it depends. So two main scenarios here. So in this scenario one, we know that this soft marker has a mild association with trisomy 18. So if you look at this first checkbox there, if you have had any prior test that was low risk regarding screening for trisomy 18, no further workup for trisomy 18 is recommended. So you're good to go. You're done. All right, so let's say scenario two, you have not yet had any blood tests done. Okay, you come straight in the door, you're doing your anatomy ultrasound right around 20 weeks, and they tell you there's an ultrasound finding of a choroid plexus cyst. Okay, so that's where we stand now in scenario two. So you can see I've circled this here. If you've had no prior blood test, then the option in the discussion is talking about cell-free DNA screening. Sometimes they call it non-invasive prenatal testing. Whole separate video I have on, it'll be listed as what is Down syndrome screening because the test, the blood test that screens for trisomy 18 is the same blood test that also screens for trisomy 21. Okay? So again, choroid plexus cyst, not associated with Down syndrome, associated with possibly Edwards syndrome, which is trisomy 18. The blood test is the same for both of them. Okay? So if you need to get more information on that, see the other video. Otherwise, keep on trucking here, right? Now that we are in the scenario of someone who has not had any blood testing done for trisomy 18, let's say without any prior testing, how can we estimate your risk? So the soft marker we're dealing with here again is a choroid plexus cyst, or a CPC. How associated is it with trisomy 18? Mildly. What is the exact association? It's a likelihood ratio of less than 2. So if you look at this table I have here, we are working on answering the question I just talked about. When an ultrasound shows an isolated choroid plexus cyst and you have not had any blood testing for trisomy 18, what then is your new quoted risk? Well, it depends on your age. So in this table, I am going ahead and basing this on a likelihood ratio of 2. Now, most data supports that the likelihood ratio is actually less than 2. So this would be the highest quoted risk based upon your age. So let's look at someone who's 20 years of age. They walk in the door, have not had any blood testing for trisomy 18. Their baseline risk for trisomy 18 as a 20-year-old is approximately 1 in 5,000, which is 0.02%. All right, now they've had an ultrasound, and on that ultrasound, there is an isolated choroid plexus cyst. Now we can say the quoted risk of trisomy 18 is as high as 1 in 2,500, which is 0.04%. Okay, so we went from a risk of less than 1% when you walked into the door to still less than 1%. Now let's go to a 40-year-old. Same scenario, walks in the door, no blood testing for trisomy 18 as of yet. Risk is approximately 1 in 333, which is 0.3%. Now, an isolated finding of a choroid plexus cyst is seen. What is your new quoted risk of trisomy 18? As high as 1 in 167, which is 0.6%. So we went from a risk of less than 1% to still less than 1%. So when I say that it has a mild association and a likelihood ratio of 2 or even less than 2, and we're using 2 as the highest number here for these calculations, your risk would go from less than 1% to still less than 1% with an isolated choroid plexus cyst if you've had no blood testing performed to screen for trisomy 18. So since I've mentioned trisomy 21 here and there, and most people feel that blood tests that are done for genetic quote unquote screening in pregnancy are almost always just for Down syndrome, I want you to just see the difference in the age-based risks of trisomy 21 versus trisomy 18. Trisomy 18 is much more rare than trisomy 21. So you can just see the numbers here of the difference between the age-based risks when we counsel individuals and how that may change after we have an ultrasound finding. So now that we have expanded our knowledge and learned some about choroid plexus cysts, let's work on developing some skills. This is an example of the one big flow sheet regarding soft markers. And as you can see here, there's a purple box about developing skills. So we are going to dive into those questions more specifically here. And in general, the whole point is being able to start a conversation with your provider, being able to ask the right questions about blood testing, and also being able to ask if there's any follow-up needed and what that may look like. So this is a copy and this shows you what the download looks like. It's at drlexihill.com/CPC. The blue box that you have on the screen that you'll be able to see on the download goes through everything that you just learned about how to expand your knowledge with regard to choroid plexus cysts. The purple box now with this section goes through the skills you need, things that you can do, and also things that you can ask your provider. So know if you have had any blood tests performed to screen for the risk of trisomy 18. Also, ask for a genetic consultation if you'd like more information about this soft marker. It's always a good idea to ask if you have any more questions. And also, genetic counselors can help you to go through the results of any blood testing you've had done for trisomy 18. Next, things to ask your provider. Ask them, did I have a blood test performed called cell-free DNA screening? Next, can we review the results of any blood test I had performed that was screening for trisomy 18? So there are different types of blood tests, and it is really important that you know which test you had performed so you know how good the results actually are from that test. Next question. I know that invasive, it's also called diagnostic testing, is an option to everyone. Can we just talk about this a little bit more so you can get information on if it's something that you would like to have performed, not necessarily for just an isolated choroid plexus cyst, just to educate yourself if it's something you may or may not be interested in. Now that we have expanded our knowledge and we know more about a choroid plexus cyst, we've developed some skills on the questions to ask and things that we should know when we're going into the office for a follow-up regarding these items. Now it's the question of impact. Why is this such an important topic? My nephew had a choroid plexus cyst in utero. It resolved in the 3rd trimester. We didn't know all this information back then. The impact that this has is being able to know that other people out there have experienced this, not just in this day and age, but back in the day as well. They may have gone through a lot of scary times, confusion, and not really knowing what to do. Now we are armed with the ability to know more and being able to ask the questions, and that impact is huge. An isolated choroid plexus cyst should not stress you out in a pregnancy. The data is clear around the fact that it will resolve. They will go away. And when they are isolated, these do not affect the structure or the function of a baby's brain. Big recap points here. I just don't want to forget to say them. Everyone needs an anatomy ultrasound around 20 weeks. Everyone should be offered a blood test to screen for the 3 most common chromosomal abnormalities. They are 13, 18, and 21. And 18 is the one that we talked about today that's associated with choroid plexus cysts. Finally, if you have a finding of a choroid plexus cyst, please ask the questions that we talked about today about blood testing that was performed. And if you would like also to talk more about the results with a genetic counselor, and ask also if any follow-up is recommended for your specific scenario. Don't forget to check out the YouTube channel and follow to watch more videos on soft markers and also specific videos on individual soft markers. Let me know if you have any other questions or comments below. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.